Let's go back to 1993. The problem stream was active. Healthcare costs were eating the economy, and a recession made the middle class anxious about losing insurance. Clinton was elected with a mandate to fix it. He appointed his wife, Hillary Clinton, to lead the task force. The solution they chose was managed competition, a complex system of purchasing alliances. It was technically sophisticated but incredibly complicated. The first strategic error was secrecy. The task force met behind closed doors. They locked out Congress. They locked out the medical associations. They locked out the insurance lobby. They believed that if they just worked hard enough, they could produce the perfect bill. They emerged months later with a 300-page doorstop of a bill and dropped it on Congress. This violated the rule of coalition building. Congress felt disrespected. The stakeholders felt ignored. They had no ownership of the plan, so they had no reason to defend it. The insurance industry, HIAA, having been shut out, went to war. They launched the Harry and Louise ads. These featured a middle-class couple sitting at a kitchen table, looking at the bill, saying things like, "They choose, we lose," and "There's got to be a better way." It was devastatingly effective media advocacy. It reframed the complex plan as a big government takeover that would restrict choice. Public support collapsed. The bill died in committee without ever getting a floor vote. It was a humiliation. Fast forward to 2008. Obama's team, led by Rahm Emanuel, who had worked for Clinton, studied the failure of '93. They adopted a completely different strategy. First, do not write the bill in the White House. Let Congress write it. This gave the committee chairs ownership. Second, get the stakeholders in the tent first. Before they announced the plan, they cut deals with PHRMA and the Hospital Association. These deals were controversial but essential. They told PHRMA, "We won't let Medicare negotiate drug prices, saving you billions, if you support the bill and run ads for it." They told hospitals, "You will accept lower reimbursement rates, but we will give you 20 million new paying customers." They told insurers, "You have to cover sick people, pre-existing conditions, but we will force healthy people to buy your product." The individual mandate. This neutralized the opposition. Harry and Louise stayed home. They also chose a policy model that was technically conservative. The ACA structure, mandates, subsidies, and private insurance exchanges, was originally a Republican idea from the Heritage Foundation. It had been implemented by Mitt Romney in Massachusetts. Obama hoped this would attract Republican votes. It didn't. The politics stream was too polarized, but it did make the plan easier to sell to centrist Democrats. It wasn't socialized medicine, it was market-based reform. The process was ugly. They needed 60 votes in the Senate to break the filibuster. To get the 60th vote, Ben Nelson of Nebraska, they added the Cornhusker kickback, a special deal giving Nebraska extra Medicaid money. It looked corrupt. It damaged the bill's popularity, but it got the vote. This is the reality of legislation. As Bismarck said, laws are like sausages. It is better not to see them being made. But to pass the ACA, they had to make sausage. Then disaster struck. Ted Kennedy died. A Republican, Scott Brown, won his seat in Massachusetts. The Democrats lost their 60th vote. The policy window was slamming shut. Most advisors told Obama to give up and pass a small, skinny bill. Nancy Pelosi said no. She engineered a complex parliamentary maneuver, deem and pass, reconciliation, to force the bill through with a simple majority. This required immense political courage and discipline. Without Pelosi as the policy entrepreneur, the ACA dies in January 2010. To conclude, Lesson 4, the difference between 1993 and 2010 wasn't that the ACA was a better policy, it was that the strategy was better. They managed the stakeholders. They bought off the veto players. They accepted an imperfect bill rather than no bill. They understood that in a democracy, you don't get to be a philosopher king. You have to be a deal maker. The ACA is frozen politics. It reflects the deals made in 2009. In the final module, Module 8, we will look at what happened asterisk after asterisk the bill passed. We will look at implementation, the courts, and the future of bioethics, because passing the law is only halftime. See you in Module 8.